OCD, Waswas, Scrupulosity. What do these terms mean? Have you ever wondered what is the difference between them? Are you absolutely sure you are not a silent sufferer of these disorders? Obsessive-compulsive disorder, OCD, is a mental health condition that affects millions of people around the world. And you could be one of them. Many people with OCD experience intrusive thoughts and repetitive behaviors that can interfere with their daily lives. If you are struggling with persistent and unwanted obsessions or feel driven to perform certain rituals, it may be a sign of OCD. Stay tuned and subscribe to stay informed about this incredible yet devastating condition that, if left untreated, can ruin lives. People with OCD experience unwanted and intrusive thoughts, images, or impulses, called obsessions, that cause them anxiety or distress. Yes, even on taboo matters. They also perform repetitive behaviors or mental acts, called compulsions, to try to reduce or neutralize their obsessions. OCD, Scrupulosity, and Waswas are different forms of obsessive-compulsive disorder that involve obsessions and repetitive compulsions that cause significant distress or impairment. Despite their differences, all of these forms of OCD can have a profound impact on an individual's daily life and well-being. No, OCD is not psychosis, which involves hallucinations, delusions, and a detachment from reality. People with OCD often recognize that their obsessions are not grounded in reality, but they feel compelled to perform rituals or behaviors to alleviate anxiety. Treatment for OCD usually involves a combination of therapy and medication to help manage symptoms and improve quality of life. But I strongly believe, due to my experience, that therapy in most cases is enough. OCD can affect anyone regardless of age, gender, culture, or background. It typically begins in childhood or adolescence and can persist into adulthood. It is considered a chronic condition, but with proper treatment, individuals can learn to manage their symptoms effectively. The exact causes of OCD are not fully understood, but some possible factors include genetics, brain structure and function, life events, post-traumatic stress disorder, and environmental influences. OCD can be diagnosed by a mental health professional based on the criteria from the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. The main criteria are the presence of obsessions and/or compulsions that are time-consuming, take more than 1 hour per day, cause distress or impairment in social, occupational, or other areas of life, and are not due to another medical condition or substance use. The obsessions are recurrent and persistent. So, like, obsessions are those thoughts or images that keep coming back and bug you, making you feel all anxious and uneasy. You try to ignore or suppress the obsessions or to neutralize them with some other thought or action, aka compulsions. The compulsions are like repetitive habits, such as hand-washing, checking, organizing, or mental actions, like praying, counting, repeating words, that the person feels compelled to do in response to an obsession or following strict rules. The compulsions are meant to help ease anxiety and prevent distress or dreaded situations, but they may not be connected to reality, or they might be a bit excessive. As I have mentioned before, OCD, Scrupulosity, and Waswas are different forms of obsessive-compulsive disorder that involve obsessions followed by compulsions that torment the person. OCD is a widespread anxiety disorder with different subtypes such as checking, contamination, and taboo thoughts. It involves intrusive obsessions and compulsive behaviors, which are done to reduce anxiety or guilt. This affects people in various aspects of their lives. The complexity of OCD is seen in its ability to appear in different forms, making it important to understand its wide-ranging impact. Scrupulosity is a fascinating type of OCD that focuses on religious or moral obsessions, like an intense fear of sinning, doubting one's faith, blasphemy, or feeling guilty for small transgressions. It explores the world of metaphysics and fears. This particular form highlights the subtle ways in which OCD can connect with deeply held beliefs and values, adding an extra layer of complexity to its diagnosis and treatment. Waswas is a term used in Islam to describe the whispers of the devil that try to tempt or mislead believers from the right path. In most cases, the OCD loop forms in the brain due to continuous intrusive thoughts, delving into doubts or lack of religious knowledge. Waswas can also be seen as a form of scrupulosity that affects Muslims. These conditions, although different, have a common thread in the form of intrusive thoughts and compulsive behaviors. Understanding the unique aspects of each, as well as their different presentations, is important for promoting empathy, awareness, and effective treatment approaches. Whether you're navigating the everyday challenges of OCD, the unique complexities of scrupulosity, or the deeper aspects of waswas, it's important to handle these conditions with care, acknowledging the various ways they affect people from all walks of life. In conclusion, obsessive-compulsive disorder, OCD, scrupulosity, and waswas are intricate manifestations of the human mind, each presenting unique challenges and impacting individuals in distinct ways. Thank you for getting educated and for watching.